So our presentation today is on Aquatic Safety Program Best Practices. Brent Okeson's going to start us out on that. Brent, you good to go?
Yep, good to go. I've got it here. So hello, everybody. As mentioned, we want to talk about some things that we've learned this past year in partnering with the American Red Cross. We've had a good program where they've come around and visited many swimming pools throughout the state at the entities we work with. And there's been some really good positive things that we've learned from that. And we thought, you know, we ought to share this information and really get everybody together so we can talk about these kind of things and you know, learn and improve upon the management of our pools. And one of the key takeaways from this is how it benefits the management of the pool and specifically managing lifeguards and making sure that things are in place to ensure that it's a safe operation, that the right procedures and programs are there. And so we're going to highlight some of those things today, things that we can learn from and hopefully improve and share throughout the state as we look at these different swimming pools and programs like that. So today we do have a couple of guest speakers, and we'll talk through that. We're going to talk about the purposes of the program, the reason why we did that, kind of the benefits that come from that, and how we can go forward in making things better. So we'll look at the best practices, and then a couple guest speakers will talk to us as well. So coming up here, I've got Mike Stagg, who's visiting here at the Trust with us today. He's from the American Red Cross, and he's the Aquatic Strategic Account Executive. And he's going to give us a little introduction now on the Aquatic Examiner Service and what that means for the entities here that we support at the Trust. So, Mike, I'll turn it over to you.
Perfect. Thanks, Brent. So, yeah, we're excited to partner again with the Trust as the Red Cross to come in and provide this Aquatic Examiner Service to everybody. The goal of the service is, as you all know now, is to help improve the safety of the facilities that you have. We're not coming in, we don't necessarily try and call it an audit, because an audit connotates we're just trying to catch you guys doing something wrong, and that's totally not it. What we're doing is we're coming in and we're working together with you just to make your facilities as safe as they can be. Make sure your lifeguards are always in a place to succeed, and that you as pool managers and as facility directors and staff, you guys have all the tools that you need in order to be successful, to have a very good, robust safety program. And that's what this program is all about, is all about education and working together with the Trust and with you guys to make sure that everything is as safe as it can be. And we're always in a place for our lifeguards to succeed in case something happens. So we're super excited to partner again with the Trust this year to bring this service back. And it's going to follow about the same format that we had last year for what we were doing last year with y'all. If you haven't been delivered everything that you were supposed to be delivered for 2017 yet, that will be delivered before Memorial Day this year. So everything will be taken care of for you. So if you've got some visits still outstanding that you need, those are being scheduled. You've probably already been contacted about that, and those will be taken care of for you this year. Also, we are going to start this month. We're going to start getting those new contracts sent out for this upcoming season. It's going to be kind of the same format that we had last year, where it's going to be a contract that will come out to you through DocuSign that you'll have to take care of and sign, both a disclosure statement about letting the Trust have access to your materials, and then the statement of allowing the examiner service to come in. Again, the Trust has been great, and they're going to take care of all the funding for the program, so all you have to do is sit back and enjoy the results, which is fantastic, that you have a great partner here with the Trust, that they're willing to do that for you and reinvest in you and your staff to make everything as safe as it can be. So we'll get that process on the contract part going this month in February, and you should have something out to you within a couple of weeks. And we just ask that those things be taken care of and sent back ASAP so we can get things started. We want to get the ball rolling early this year because we were kind of behind the 8 ball last year when we set this up to get everything done for Memorial Day. So things were kind of crammed in, but we're going to have a much smoother transition this year. So expect something to come through soon. If any contact information has changed, the authorized signatory or the people who we should be contacting to set up the visits, if you can please let me know. My email is mike.stagg, so first name, last name, @redcross.org. please let me know if anything's changed that we need to change on our end, and we will get that taken care of for you. The program's going to be the same as it was last year. If you have an outdoor facility, you'll be receiving your annual lifeguard operations assessment walkthrough with us, as well as 3 unannounced visits to your site. If you have an indoor facility, you'll receive 4 unannounced visits to your site. If you have a facility that is both an indoor, you have an indoor component and an outdoor component, you'll receive your annual lifeguard operations assessment for both facilities, and then you'll also receive 2 visits at each facility. So 2 unannounced for your indoor and 2 unannounced for your outdoor. And we found that this is a good number because it gets you that training that you need and all that educational materials so that you can then make those changes and those recommendations to your staff to help them be successful. And so, again, we're super excited to be here and to partner with everyone and to work closely with you guys. I know I've had a chance to speak with many of you in person about this, and we're getting a lot of really, really good feedback about this. One of the, just a quick experience, I was actually with my family on vacation. We were near one of your facilities, and so I took my family over there, and we drove up, and on the window of the facility, there's a sticker that you've all received that says, proud partner of the American Red Cross Aquatic Examiner Service. And so we're sitting out there in the parking lot. The pool hadn't opened yet, but we're sitting there in the parking lot, and there was a family who had come in who were clearly from out of town. They had out-of-town license plates, and they come in, and they pull up close to the doors, and they're looking inside, and the dad says, I don't know if this pool's going to be safe or not. I want to make sure it's safe for the kids, if they have lifeguards or whatever, because we couldn't see anybody because everything was closed up right now. But then Mom saw something in the window. She saw that sticker, and she said, no, these guys will be good. They're going to have good staff. It's going to be safe because, look, they partner with the Red Cross in some aquatic safety program. And so it is being noticed by members of the public that you're participating in the program and the changes that are being made if they're necessary. It's reaching out to the communities that you're in, and so we're very, very proud to stand with the trust and with you guys behind the program. And so if there's ever any questions or ever anything you need, feel free to contact myself or contact Jason or Brent or Doug or whomever you need to here at the Trust, and they can get it back to me. But again, we're super excited and proud to partner with you guys again, and we look forward to a really, really good year with you.
Thanks for that, Mike. That's a really good introduction there, and we appreciate your support on that. I can vouch for that. I've been a safety manager for almost going on 12 years now, and I've learned a lot of things. I've learned to look at things at facilities, but I did go on some of these aquatic examiner visits where we did a little walkthrough on the facilities there, and I learned from them. I learned several things that stood out to me that were beneficial, and so I do think it's a good program, and we appreciate your help with that. So thanks, Mike.
No, thank you.
Yeah. This is just a summary slide that we put together. It covers the same things that Mike had just talked about, but really the point of the program is really to improve lifeguard performance, to make it safer at the swimming pools, to help identify gaps in training or operating procedures. They'll do the pool visits, as Mike mentioned. He talked about those, doing skill evaluations and surveillance and things like that can really help to make sure your lifeguards are doing the right thing, that they're really paying attention, covering their zones properly, and that you have all the reports and documentation and safety procedures and everything in place at your pool to keep it a safe facility and safe run operation there. So it's a really good benefit, a great opportunity that we can work with the Red Cross on this, and some good things. So we're going to talk now. I want to talk about a few things that we found. Having gone around the different entities, there were 32 entities this past year that the Red Cross went out and visited in partnership with us here at the Trust. And there was a kind of 10 common findings that we found and recommendations that we saw. And we thought, you know what, we got to get that information out, because if that's something that's happening, if there's trends that we're seeing or anything new that's standing out, we want to share that information. And, you know, maybe that's our top priority for this year, is focusing on those top 10 things to make sure that our pools are more safe, that our procedures are in place, that things are being done the right way. So we'll talk about those things. I'm going to run through those top 10. And just to point out, 32 entities that we went around. There were several visits at those entities, and there were multiple aquatic examiners that came out to do that, some coming from even other parts of the country to fly in and do those. So there's some experienced examiners that came out and did that to provide that information. So we'll jump in. I'm going to show you what we found as the top things. Probably the biggest one that we saw that was kind of a trend that we saw here, and one of the most important things that we found, some of the locations were lacking in their emergency action plans. Some of them did not have the plan. Maybe it wasn't quite written properly, or maybe it wasn't available or accessible. Oftentimes the lifeguards would be asked, what is your emergency action plan? And they would know it, but when asked for a copy of it, or where is it posted, or where can we get that, sometimes they didn't quite have that information. So that's one of the recommended best practices, is make sure you have that plan in place. And that's really for any land or water-based emergency. What do you do if someone goes down, or if someone needs to be rescued, or we've got a medical situation? What is the plan that the facility is going to have in place? It's really important to have that, and make sure your lifeguards are trained on it. Make sure it's all spelled out as to what needs to be done there. A couple things on that too that stood out in looking at this is sometimes the drills hadn't been conducted frequently enough, or maybe even not at all. It's important to do a drill, do a practice, so that people know that if there is an emergency, what steps do we take and how do we get through doing that the right way. Part of that emergency action plan is having whistle signals spelled out. There were times during the visit that I did, they would ask a lifeguard, what's your whistle signals? How often do you use the whistle? When do you? And asking things like that. And they knew it, but sometimes couldn't provide that documentation of where it's written down or where it's posted. So it's important that we make sure those plans are in place. That's probably one of the biggest ones that we saw to focus on there. The next thing that we saw was related to zone charts, and a lot of the lifeguards knew where they were supposed to be. However, having those things posted and clearly accessible can really help those lifeguards to understand where those zones are that they should be watching and surveilling on at that time. So make sure your zones are posted. Make sure they're clearly identified. Make sure that there's a good overlap and full coverage of the pool area. You don't want to have any gaps or deficiencies, maybe some obstructed views or places where lifeguards couldn't see. You want to make sure that everything is covered in that pool and that lifeguards know exactly where they're supposed to be looking. They should know those exact boundaries and be focused on that at the time when they're watching those certain zones. Part of that too is having lifeguard rotation plans. If they do rotate, they're going to different zones throughout the day. They need to know where those different zones are and know where they're supposed to be covering during the rotations. So that's another thing that we saw that was a trend, making sure those zone charts are posted, that they're clearly identified and accessible. Definitely a recommended best practice there. Uniforms is another thing. All of the assessments, as Mike mentioned, they have a checklist that they use when they provide these reports. There's a lot of consistency in that, and they look for the same things at these visits. And one of the things that comes up a lot of the times is the uniforms. It's really important that lifeguards are easily identifiable. That's for safety reasons, for the public, for the patrons of the pool, and really for other lifeguards as well, to be able to identify where those guards are. If there were an emergency, it's important to be able to identify them. And part of that is wearing the proper uniform. There were some times where lifeguards were identifiable easily, and some maybe not so much based on the type of clothing or uniform they were wearing. So make sure that they are easily identifiable, that they have something visible that you can tell where those lifeguards are at the pool locations there. Another recommendation that the Red Cross provided was that supervisors have a different color shirt, or managers of the pool have a different color shirt, and that's so that they can be identified as well. In the case of an emergency, you're going to want to have your supervisor directing emergency personnel, or even the public reaching out to the supervisor if there's a need. It's important to have them maybe with a different color shirt to make them a little more identifiable as well. So watch for the uniforms. The other thing we saw was rescue tubes and hip packs. These are definitely a big recommendation here, to have the lifeguards wear these hip packs with available equipment to respond to an emergency or a medical issue. In these hip packs they can have resuscitation masks or gloves or other things that they need to that during the rescue. Some of the cases we had didn't have these things readily available. They were a little bit out of the way, or they were setting down somewhere. They weren't necessarily with the lifeguard, but it's important to make sure your guards have that. That's a big recommendation there. And this really reduces the potential for a bloodborne pathogen exposure. If you have the gloves and the right equipment and, PPE and things that you have in that hip pack ready to go, you're not scrambling around if there was an emergency trying to find something and not having the things to protect yourself. So that's a recommendation to have those on the lifeguards and have them ready to go. Several of the reports identified the need for BVMs, a bag valve mask, and what this is for is, in the case of resuscitation and CPR and getting the airways going, this is one thing that can be available that makes it a lot easier in that case, where you can have an adult and pediatric mask available to provide that oxygen as you're trying to get air into someone during CPR. So the BVM, it actually provides a higher percentage of oxygen than does somebody just naturally breathing into somebody's mouth, and it reduces chance of bloodborne pathogen exposure. So it's really good equipment to have. You might want to have one of these nearby at your pools. They were recommended in many of the reports that we looked at. We also looked at AEDs, and this is really for any facility, but specifically at the swimming pools. We looked at AEDs, and some of the reports showed that there were no batteries sometimes, so maybe the battery wasn't fully charged. It's really important that if you do have an AED, it needs to be maintained and it needs to be ready to use. Fully charged, available, accessible, all of that needs to be for the AED. You think about this, if somebody were to go down and have a medical issue and you got to get this AED out and use it, and you open it up, you're going through all the, the emergency procedures, you go to turn that thing on and you don't have a battery running, you're going to find yourself in some tough situations, because if you have that AED, it's on you to make sure it's ready. That can get you into a liability issue for not maintaining the AED or having the battery charged or ready to go as needed. So make sure your staff know about the AEDs, get the training on those, how to use them, and make sure they're ready to go. We recommend a monthly inspection at least on AEDs to check for that battery to make sure that they're set and ready to use. So one more there. Bloodborne pathogens. This was another topic we saw, and there's many things that kind of go along with this. But these are bloodborne infectious viruses that can be transmitted, and you never know. The best thing to do is have universal precautions and make sure that you're protecting yourself. But part of that is every facility needs to have a plan in place. They call it an exposure control plan. It's really important that everybody has a plan, that they're trained on it, and that there's procedures and steps there to protect staffs that are responding to medical emergencies, that they're protected from getting in contact with potential infectious materials. And so part of this, in the reports we looked at, some of them had the plan, and it was a written plan that they had, but sometimes it wasn't available, or it wasn't posted in an area where somebody could find it, or maybe the lifeguards weren't fully familiar with the plan. They had maybe been trained on it, but weren't couldn't remember the details of the plan or where it was. So part of that is making sure that you do have that written plan, make sure it's available, and make sure that your staff get their annual bloodborne pathogen training. Really, any first aid or CPR responder that's trained to do that needs to understand the implications of bloodborne pathogens and how they need to protect themselves. And so that's one thing identified in several reports, was making sure that training is conducted. There were some that were deficient on that, and making sure it's available on that right there.
Hey, Brent, could I jump in there for 1 second? Just a reminder on that. We did a webinar. We have a recording of that on bloodborne pathogens. It's on our website. So it's not a complete program. You still need to talk about exactly what you do in your operations, but it would be a good start for that bloodborne pathogen training if you need that type of just the basic training for that.
Yeah, absolutely. Thanks for that plug, Jason. And same thing goes for safety data sheets. We've also done webinars on this in the past, and there's information available with training that are on our website as well for this. But when it comes to this, it's important to have a listing of all the chemicals that you have in your workplace, and get those into a binder or a folder or somewhere that you can have it accessible to employees. Really, these safety data sheets will tell you, what's in the chemical, what's the properties of it, how do you handle it, how do you store it, what if there's exposure to it. Having that information on hand and accessible can really be of great help, and it's actually a requirement that OSHA has for the workplace. So any chemical that you're using, in addition to a normal household use, really any chemical you have at the pool, you're going to want to have listed there. We've done training in the past, as I mentioned. There's a webinar on this about the globally harmonized system, how the United States has now gone to this system where it harmonizes things, where there's more consistency in the safety data sheets and how their formatting is and the information provided there. So part of that is you might want to go through your SDS sheets and look back at the old ones and make sure those are updated to the current ones with that GHS format to make sure that you have the right ones in there. So looking at the reports that we saw from this past year in the state, there were some that didn't have their book available. We asked, where's your SDS sheets, or, where can we find that? People said they had it. Sometimes they couldn't produce it, or it just wasn't quickly accessible. So look around your facility and make sure you do have that. Make sure they're updated and that you have all chemicals accounted for in the workplace that people might be working around. Documentation is a big one, and this is something that's kind of on the management and supervision side of things. But this is something where, documentation can go a long way. If you ever have, complaints or accidents or injuries or, medical issues, things that go on, having documentation can really help to show that you've done training, that you've done the right things, that you've provided the right maintenance at the pool. Keeping documentation is critical. And so we recommend have a good filing system, have a good place where you keep all of your documents. Make sure your written policies and procedures are available, that they're printed out, that they're stored and easily defined. Have all your training records in one location. Have them in a good system that if anyone has questions about lifeguards training and whether they were trained, or when are their refreshers due, or when do things expire, have that information all documented properly and in a good location. And that goes for all facets of the organization there at your pool, whether it's maintenance or inspections, all the things you're doing, testing times for lifeguards, for response, all that kind of stuff you're going to want to have in a good location there. And the Aquatic Examiner Service, they look at this. They come out and they look at your documentation. They find if there's any gaps or anything missing, or if there's any other documentation needed, they will help to identify what's needed there. Part of that documentation is keeping training and certification records. And they looked at this. They would ask, how often are you doing your regular in-service trainings? Some were doing monthly, some were doing, every 2 weeks. But they're going to recommend what's the best practice for that. And 2 weeks seem to be about the appropriate recommendation for that, every 2 weeks for your staff doing the in-service training. There also should be an annual orientation training where new lifeguards are fully trained, and then also the ones that are coming back, maybe it's a seasonal pool that you have, they should be trained as well each year before the pool opens. And so make sure you're doing your annuals, make sure you're doing your bloodborne pathogen training like we talked about, and making sure that you have your certificates and training records available. Some organizations will keep their records and certifications, copies of those at another location, and that's okay. But you'll probably want to have a copy of those at least on site as well, so that the managers of the pool and everyone can make sure that everyone on site has the right training and records available. So watch for those there. Also, in regards to training and certifications, it's recommended that you have at least one CPO, which is a certified pool operator, or an AFO, an aquatic facility operator. At least one of those should be on site to make sure that everything's running the right way, that the management's being done properly, the pool's being managed, as far as all facets of that. So have at least one of those at your organization there. The Red Cross also recommends their lifeguard management training. They have a certification through that you can get through the Red Cross, and that's recommended for anybody that's a supervisor or manager of a pool, that they can understand how to better manage lifeguards and make sure that the surveillance zones are covered, that rotations are being done right, that the lifeguards are doing what they need to do to keep each other safe. So that's one thing that they recommended in a lot of their reports from the visits, was making sure that your supervisors have that training. And then other certifications as well. Your lifeguards may need certain certifications, first aid, CPR, maybe you have some deep water lifeguards that need certification trainings for that. Make sure your staff have all the training that they need. And so that's really kind of the top 10 of what we found. These are kind of the ones that stood out to us, that looked to be, some of the more important, some of the more critical findings that came from these visits, and also some of the more regular ones that were really important. So we encourage you to look through those things and make sure that your pools have that type of information, that documentation is being done, that lifeguards are being managed, and all the documentation things are posted right. So that's kind of the goal from that. So we also have another visitor actually called in, Wendy Harris. She's from the Uintah Recreation District. She's on the webinar here with us today. She's the Aquatics manager there, and she's going to talk a little bit about their emergency action plan and how their policies and procedures tie into that, how they develop that, and maybe some good pointers for the rest of us that we can learn from on how they did things. So, Wendy, are you there?
Yes, good morning.
Good morning. Go ahead. I'll turn it over to you.
Okay, I also have Dara Vona. She is my aquatics coordinator with me also, and we put together a policy and procedures manual for our lifeguards on top of the one that we already have for our facility, but this one's exclusive to the lifeguards. This one, in it, we have like the job descriptions, the qualifications, all of the information they need to know, and in that we also have our emergency action plans, where we just have a detailed list of what is expected of them. So one of our bullet points is whistle commands, and that goes over, you know, what our whistle system is. For instance, one whistle at our pool means just to alert the patron to get their attention to follow a rule or something like that. 2 whistles would mean they are going in the water, they don't need assistance, just cover their area. Then 3 whistles would mean they're going in the water, they need assistance, something like that. Everybody has different whistle commands. It just needs to be located in there so that everybody knows what your policy is. We also have our basic EAP procedures for like weather, fecal vomit incidences, diarrhea, things like that, what to do for those incidences. And then we also have our pool emergency action plans that go into detail for if it's aquatic emergency, a spinal emergency, bloodborne pathogen emergency, something like that, that goes into detail doing that. How we came up with those, we actually go to a lot of different aquatic conferences. So URPA has an aquatic conference every year. We learn a lot of good stuff from that. The AOAP, the Association of Aquatic Professionals, I've been able to go to their conferences and learn from them and take from them things that we need at our facility also. And then the Red Cross coming and doing the aquatic examiner service, we've learned a lot from that also. We've had them come out in the past, and we learned about the AEPs, you know, having this policy and procedures book through that course. There also is aquatic meetings that we hold monthly with Kathy Olson. She is the URPA rep for the aquatics, and she does a phenomenal job too. So we meet with her monthly, and we can go over things that we feel that we need to improve on and get others' ideas and stuff to help us out. We use the internet, obviously, and went to other facilities. West Valley helped us out a lot in theirs. We took some of their stuff, as well as the co-college there in Iowa. We have a fellow coworker that works there. And just working together and taking from other facilities that we like and putting our own together is kind of how we put ours together. So.
That's great. That's great information. And I'm sure a lot of other entities kind of do the same as you know, learning from other entities and taking best practices. So that's a great example there. And you think about it, it's important that we have that plan in place, you know, thinking about what could go wrong, how do you handle those situations, and how do you know, what's the right whistle commands and procedures and, you know, all of that. So it's really important to have that. I appreciate you taking time to tell us that, Wendy.
Yeah, thank you.
Thanks for that. So we'll keep going here, and like I said, we talked about emergency action plans being one of the biggest things that we saw, and that's why we wanted Wendy to get on and talk to us, because you know, that's a real concern. You know, what do you do in those cases? And we did find from several of the visits this year that there were some deficiencies in that. So again, take a look at your emergency action planning, make sure that's being taken care of, as we've talked about here today. And then management is another thing we wanted to talk about as well. You know, it's really important to make sure that your supervisors are trained, that people are being held accountable and doing the right things. When it comes to safety at the pool, you know, this could be a real huge liability or a huge deficiency if you don't have management that has, you know, the right support, not having the right training, you know, maybe lifeguards aren't being held accountable, not doing the right things. You can see how that could trickle down to be a real problem in doing those things there. So make sure that you take action on that. Make sure that managers and supervisors have what they need, that you have everything in place, that people are doing the right things. And part of that is when it comes down to discipline. If you have lifeguards that aren't, quite doing the job they're asked to do, or they're just not paying attention, maybe they're not watching their zones, or things aren't being done right, there should be some type of discipline there to coach them and mentor them and help them do the right things. And one of the best things you can do is document that. Document when you talk to them and the trainings that you do, the coaching. If there's any deficiencies, the best thing you can do is document that. When it comes to managing a pool, and Red Cross will tell you this kind of stuff when they do these visits, it's really important to own your program. You have policies and procedures, you have written manuals, you have things in place with the right things in place. Part of that is owning up to it and following it. Make sure you're doing the right things, that you're crossing your T's and dotting your I's to have management all supported there. So with that, Jason, did you have anything else to add on management side?
The major thing on that is we really need to take action, yes, on our guards if there's disciplinary issues, but from a management standpoint as well. If we have a supervisor that's not cutting it, we need to take action. We need to do the appropriate thing, document what we're doing there, and not be afraid to take action if there is a deficiency in their performance in the things that they do, because in a lawsuit, all of that stuff will come out, and there'll be specific questions about a supervisor, about managers, and how things are working. And if a plaintiff attorney is able to find a deficiency that we have not properly addressed, that's a good opening for us to end up losing a lawsuit. And so it's just part of our management that we definitely have to pay attention to. And while I'm still talking, we really appreciate Wendy talking about her program, and we know there are a lot of great programs out there. Just highly encourage you, if you find a deficiency in some part of your program, maybe your emergency action plan is not quite as good as it ought to be, don't be afraid to call and ask others in the state. Call us, and we can point you to people that, hey, this program has a great program. Don't be afraid to ask questions and share, because we all get better together through this program. That's why the trust was willing to pony up the cash to do this program, was so that all of our programs can get better. We need to learn from each other. So that's what I've got. Thanks, Brent.
Very well said. Thanks, Jason. Thanks for that. So kind of to summarize and wrap up from what we've talked about, we talked about the best practices that we saw from the AES program. Things that stood out to us, there were trends, and again, we encourage you to make sure you have those best practices in place at your pools. Again, look at your emergency action plans. That's one of the biggest things we saw. One of the most important things you can do is make sure those are in place and ready to go. It's all about lifeguard management. As Jason mentioned, having management of the pool, making sure lifeguards are doing what they need to do, that's critical. And part of the program will help you to identify things that you can do to improve that. So we encourage you to take advantage of this aquatic examiner service. They're going to come out, they're going to do visits, they're going to identify really good things for your pools. We encourage you to take action on those things. Find if there are any deficiencies or things that you can do better, improve on those things, because that's really the whole point of this program. So follow up on recommendations and really commit to improving over time. That's the goal here. And we appreciate everybody being on here. That's our message today. If there's any questions, Jason, do you see any questions coming in?
Yeah, we do have one question. Bryce asked, what's the trust take on the MAHC, or the Model Aquatic Health Code? I won't leave Brent hanging on that one. I actually attended a presentation on that at a conference fairly recently, and I said, oh my gosh, we got a lot of work to do when it comes to that side of things. It also grossed me out quite a bit when I found out how much fecal matter is actually on people's bottoms and in the pools. But anyway, I truthfully at this point, that is something that we are that we take seriously. But right now, we really want to focus on getting our aquatic safety program in place, and we will be focusing more on that code coming up. I do believe it has a lot of good within the code, but it's definitely a significant amount of work that needs to happen through our organizations, through our aquatics programs. Do you have anything to say on that, Mike? I got Mike.
Yeah. No, I mean, Jason said it great. I mean, the MAC, the Model Aquatic Health Code, there are certain things inside of that code, if you go through and read like the 18 million pages of it, that relates directly to what we're covering here, about, you know, just your aquatic safety programs, about having regular in-service training, posted guard rotations, zones of coverage, your SDS sheets, your bloodborne pathogen exposure sheets. There's a lot of that in the Model Aquatic Health Code. There's also, you know, design things and recommendations on, you know, safety procedures and such for your facilities. And, you know, that's part of this Aquatic Examiner Service program is kind of bringing in the MAC a little bit to help with you know, not just compliance, but coming closer to what it's going to be. I don't know for sure if Utah, the state itself has decided to adopt the code as law. I know that they're looking at that. I don't know if it's been done yet, or if they're going to leave it up to specific counties and cities to actually adopt and look at what parts they're going to do or whatnot. So probably more to come on that, but just know that with the Model Aquatic Health Code, a lot of it is covered in what you're receiving here with your examiner service, and what was covered by Brent earlier in the presentation.
Yeah. Thank you. I appreciate that insight, Mike. Let's see. We did have another question. Maybe I missed it, but did you say the Red Cross will continue to do these visits? Yes. We will continue to do this program. The Red Cross will come out and do those. They'll be in touch shortly, within the next couple of weeks, to get the contractual side of things done. If you get a contract there, realize that the trust is paying for this, but we do have to have some agreements in place from your end, so you understand what you're getting in, and that you can share that the Red Cross can share the information on the reports with us. The trust is we're making a significant financial contribution to this, and we think it's important, and so we hope that you will be serious about the recommendations here and take those to heart. At the end of the day, you know, we've got kids' lives on the line, and we're serious about having safe operations, and so we want to partner with you as well as the Red Cross to make sure that we've got really safe operations there.
And just one more thing real quick. Feel free to ask, like when your examiners are there, when they're coming to your facility, feel free to ask them questions. Feel free to pick their brain and see, you know, some recommendations on their part. They're there as aquatic professionals. They all have many years of experience as either in at least an aquatic director type position. So they've been there, they've done that, and they're all at least lifeguard instructors, or at the very, you know, most of them are lifeguard instructor trainers. So they're the top of the lifeguard hierarchy. They know the program inside and out. They go to a really robust training program. They have to go through every year, where they do practice teach-backs and practice evaluations and all these things. So feel free to pick their brain, ask them questions while they're there at your facility, because they're more than happy to share their experiences and share what they can do to help.
All right, thanks, Mike. Another question. So will the trust be sending out a specific review of each facility, or do we just go off the report from the Red Cross? We're going directly with the Red Cross reports. We wanted to summarize the findings just so all of you out there had kind of an overview of these are the common findings. These are the areas where we really need to focus some attention. But the Red Cross report is the Red Cross report, and that's the one that they send it to us, and that gives us a direction as to how you're performing as an aquatic program. Okay, Brent.
Well, thanks everybody. Thanks Wendy. Thanks Mike for participating, and Jason as well. Great comments and great discussions there. Again, we encourage you to reach out, use the Red Cross program, and we're here to help if you have questions as well.
Awesome. Thanks, Brent. Great job. Great job. We appreciate the time you put in for that, and appreciate all of your participation in the program. It's good stuff. It allows us to have good programs that keep people safe. So, thanks very much. If you got questions, give us a call. Talk with the Red Cross folks, and let's open the dialogue so we can continue to get better. Thanks very much, folks. Have a safe day.